Hi, this is Danny. Welcome to the 2.0 conference here, and we have our next guest, Franklyn. If you can introduce yourself
Sure.
and your organization.
Yeah, my name is Dr. Franklyn Gergits. I'm an ear, nose, and throat physician in Scottsdale, Arizona, and I work at Sinus and Allergy Wellness Clinic.
Oh, wonderful, wonderful. And um, what's it called? Where? Oh my God, help me, help me.
Which one?
Oh, what role? There you go. That's where we're at. What role does patient education play in helping individuals make informed decisions?
Oh, that's a great question. And
Yeah.
I'm a firm believer in education.
Yes.
Oftentimes, a lot of our patients come into the clinic, and oftentimes they may have information, but is it the right information?
Yes.
I mean, Wikipedia, is that really something that we want to kind of stand on?
True.
Good reference, but we need more. So what we're doing currently in our practice is we're actually doing a rebuild of our website based on
perfect.
education. So it's going to be foundational for our practice. So this way, when a patient comes in, before they come in, they can actually have a very good foundation for what we're going to be dealing with and talking about as far as their sinus allergies and their airway.
Oh, wonderful.
We also use educational technology to help explain a lot of the patient's symptoms. For example, we have an in-house CAT scan machine. So a patient will have the CAT scan done as they come into the office, if they're a candidate, and then we go over that CAT scan frame by frame with them right there in the examination room.
Very detailed.
It's very detailed. Right. We also have nasal endoscopy. And nasal endoscopy
Whoa.
also is a way for the patients to see inside the nose. Have you ever seen inside the nose before? I mean, no, most patients have not, right?
Wait, so is it like a screen?
It's a screen. So it's a monitor that's in front of the patient.
Oh, what?
So in real time, they're seeing their own nose in the inside of their nasal cavity, right? And we're explaining to them what we're seeing. So if there's
it's like a live X-ray, like almost like a ultrasound.
Well, kind of. So the X-ray picture, the CAT scan, is what gives us the individual frames, so we could really see the anatomy of what's going on.
Oh, wow.
And then the endoscope actually gives us an examination of what's happening inside their nose at the time of the examination.
Okay.
So we might see that the mucous membranes are real pale and boggy and swollen. So that might think that's allergy. Or it might be inflamed and dry, and we may even see infection. At that time, we can actually get an endoscopic culture so we can get a better understanding of what's happening with those patients. All part of education.
In depth, and it's like very, not just scientific, but very analytical.
Very much
analytical, like breaks everything down.
Exactly.
Do you have you used any like AI tools to help with that implementation?
There are AI tools. We don't have those in our office as of yet. But there are AI tools to actually give us a confirmation as far as a diagnosis, basically on CAT scans. But that's not in our hands as of yet.
Okay.
Coming.
Okay. It's coming soon.
Coming soon. Right.
Okay. And then, what do you believe distinguishes a comprehensive ENT evaluation from say that for me?
The symptomatology approach.
Symptomatology. Okay.
Right. So I like to think of symptomatology approach as reactive.
Okay.
So, for example, for a person who was going into the office, say a urgent care clinic or their primary care office, they may go in with ear pressure. Okay.
Yes.
So when they go in with ear pressure or they go in with sinus drainage, those are symptoms. So symptoms basically creates a fix. But the comprehensive evaluation, however, that's foundational and that answers questions. So what we can do is we can use the individual parts of the ear, nose, and throat, like the nose situations, like the congestion, for example, drainage that they may have. But we also put it all together for the patients as well. So that comprehensive evaluation also includes a detailed examination. And we're also going to go ahead and summarize everything for the patient so they have an idea of what needs to be done next.
Wow. So detailed.
Very detailed, right.
But it's really helpful because then you can see like a track record. Like you could see, like you can diagnose the problem, resolve it, and see the progress.
No doubt, right.
So if they, like with their record, what they need help with moving forward kind of thing. Okay. And then how do you balance new technology, because we were talking about AI, with proven clinical principles when deciding what's appropriate for the patient?
Exactly. Right. So the clinical principles. So clinical principles is what our basic examinations are. So when we go to medical school, we learn how to do a detailed examination. So not only do we want to just get some history from the patients, from them filling out a piece of paper, we need to ask questions. And we need them to answer questions, but we want them to ask questions as well. Okay? Then it becomes our examination comes next. And we'll use technology at the time of our examination. For example, the CAT scan, like we mentioned earlier, as well as the nasal endoscopy. And then they all come together for us to give an understanding to the patient as to what the root cause of their problem is. So once we establish that, then we can go ahead and initiate the proper treatment plan. And that's my ultimate goal. If I can get those patients to understand the root cause of their problem, then we can fix it for them.
Hey, problem solver.
Problem solver.
Problem
right?
solver.
We try.
And then you received an honoree award at the conference. How do you feel about receiving recognition for that for your industry?
Oh, that was awesome. And I thank you and the Health 2.0 conference for that as well. It's not often that we get recognized for our work that we do. We do get work or confirmation, and we get gratitude from our patients getting better. And that happens to us a lot. We get validation. We have reviews from our patients. And our patients get better. But having an award like this is also something special, and it's fun to get away and to come to Vegas and to meet new friends.
You go, right? Do you what was like your most memorable, I think, experience in your practice? Because you created Sinus and Allergy Wellness Center. What would you say was one of your most memorable experiences with creating like this vision for yourself?
That's a great question. Also, it's where we've come to, right? So it started out with me and my wife bootstrapping our practice, coming from Pennsylvania, relocating to Arizona.
Whoa!
And then as the practice continued to grow, we ended up really getting to the point in time where we can actually treat many different conditions, all using the endoscopic techniques that we use. Like balloon sinuplasty, for example.
Oh, is that like, tell me what that is.
So think of the angioplasty and how that's helped patients who had blocked arteries of their heart.
Ooh.
And instead of having to go through open heart surgery, they could have a balloon go inside those blood vessels that are narrow and blocked.
Whoa.
And they stretch them out, and those patients get better without having to have open heart surgery.
Whoa.
So way back in the early 2000s. So
that's like that technology piece.
Right, exactly.
Into your practice.
Right. Wow. So I found out about this at a conference, and I knew that this was going to be foundational, and it was my aha moment that I knew this was going to be a big plus.
Yes.
And fortunately, I was the first person to do the balloon sinuplasty in the state of Pennsylvania.
Whoa.
Yeah.
So do you train then your physicians that come to your practice?
We do, right.
In a specialty.
Exactly. In fact, I was recognized as a sinus center of excellence by a company called Intellis that made these balloons. And I was one of the physicians of many that would train doctors nationwide to incorporate some of these technologies and these procedures in their office.
I love that.
I know.
That's amazing.
It's great, yeah.
So not just innovative, but also like kind of a, what do they call it? Frontier, the
pioneer.
The pioneer.
Yeah,
I was like,
right,
what is this called? You're the pioneer with that particular technique, because that's very specific.
Yes.
I love that. That's amazing.
Yeah, thank you.
And networking wise, how has it been so far with the conference?
Very good.
How do you feel?
Met a lot of good friends, new friends from all over the world.
Yes.
And it's been wonderful. Just seeing different people and hearing all the lectures. It's been a wonderful time.
Oh, great! I'm glad.
Thank you. Yeah.
Have you met anybody that works in your industry?
Not yet.
Excuse me.
Yeah. One of the lectures I'll be working with later on is pain, and we will be talking about some of the different conditions that can affect the ear, nose, and throat, and pain, and how that impacts me in our practice, which is going to be really trying to talk about the different reasons for inflammation. Oftentimes patients go to the urgent care and they are diagnosed with an infection, even though they may not really have an infection. So the hope there is that we're going to be able to take away that pain associated with an infection that needs an antibiotic. So if we can get to the root cause of the inflammation, maybe it's allergies. Maybe it's the dry air here
in Vegas.
And in Arizona, right?
Well, I'm from Miami. It's usually the
humidity. Right.
The humidity is like,
right. Well, there it's a lot more fungal infections too.
Fungal, the humidity, the molds.
Right, exactly. Mold and fungus, right? Exactly.
Yes.
Yeah.
You know.
Yep.
And you're in Arizona, correct?
We are in Arizona.
Yeah, so it's very dry there too.
Yes.
Okay. Yes. And then, how can people get in touch with you? How do people collaborate with you? Is it LinkedIn or website?
Both, yeah. So Sinus and Allergy wellnesscenter.com. And my personal email is fgergitsdo@gmail.com.
Perfect. And then to collaborate, is LinkedIn the best way to reach you?
Yeah, that is the best way, right.
Perfect. All right. And Franklyn with a Lyn.
Lyn, correct.
Lyn. Yes, perfect. Thank you so much,
well,
Doctor.
Thank you. I appreciate it.
Have a wonderful time at your conference.
I will. Thanks so much.
You're welcome. Have a good one. Bye.